I'm Dr. Abdullah Mullah, and I'm here to talk about my experience in Mrcp study. I found that I have something to tell you is of much benefit, so I did this video. I see that most people, or a large percent of those taking PART2 exam, are not doing the accurate way of study. Why is that? Before going through why is that, let's discuss the PART2 exam and why it is different from PART1. They are not the same exam, by the way. PART2 exam is a deep exam. It's not a safe note exam. If the patient has something, then do something. No. The PART2 exam says if the patient has a complex issue, this complex issue is an overall picture that you will that you, the candidate, is responsible for getting that something, knowing that something, or abstracting that something from the scenario. Sometimes it's difficult, and if you know that the complex overall diagnosis or anything, or complex management, then you will get the answer. But PART1 is more direct way questions. So PART2, there will be a whole different way of study, and that's what I call the general to focused way of study. And before going through the general to focused way of study, let's discuss why it's important to not save the notes and understand the concepts. As I told you, the exam is not a safe questions, so that's for sure. Another fact that the exam consists of 40% questions which are like the easy questions, which can be solved by just knowing the bank or studying the bank questions, which is not enough. That's why I did this video. Bank questions, either going through once or twice the bank questions, they are not enough. That's why the people with more clinical experience, they get the difficult part less difficult when going through the real exam, and they pass. Unlike those without clinical experience, they struggle more. That's because the understanding the topics, not the concepts, the topics are more important to grab. And here my method is that you solve the bank questions for the guideline type questions in the exam. So you go through the bank questions either once or twice, and going through the incorrect ones, repeating as much as you can. And within the guideline, within these questions, you will find diagnostic questions also, but get deep into these questions, all the bank questions. And every time you get into a question, I advise you to analyze each question of that which you find difficult, so as you do not waste more time. How to analyze questions? So, like this question, the question talks about a patient with anemia, microcytic anemia, after gastrectomy. and below the investigation list. You can get an idea about the answer from the first word of the exam, from the first word of the question stem. But I advise you to change the question in order to get used to the more difficult of this seemingly easy question from the general log. How is that? You can remove the investigation list. Just say a patient with lethargy after gastrectomy. What would be the first line management or the best management? So here you need more brainstorm in order to solve this question. This is just an example. You may find difficult questions more than this. Another way of brainstorming the questions, which are, I call test your or trick your ability to differentiate the gray area between the differential diagnosis. Like this question, which tricks you between the TIA and TTP. This thing needs more knowledge and more understanding, not saving, of the differential diagnosis, and knowing the details of each differential diagnosis, understanding each to focused wave study. What is that? Now we are in the step of we finished the questions of the bank and analyzed the questions. So we grabbed questions and concepts, because the more important is the more difficult part and the more percentage here. It is a 40% questions. I'm talking about 80 questions of the difficult type. What is this? I found that 40% of the exam, real exam, when you go through the real exam, you will be shocked that the fact that 40% of the exam is made of difficult type questions that examine your ability to diagnose or differentiate between each differential diagnosis, not get tricked to each one. So you'll find a lot of similarities between differentials. So I'm talking about the 40% of the difficult type questions, and this 40% it's much of your effort rather than throwing to the garbage your precious time and your effort into just a bank questions or focus to general life study that most people do. Actually, I'm surprised that no one told me this way, which I advise you to do the same. The general to focused wave study, and this is aimed to ace this difficult part of the exam, which tests your ability to diagnostic skills. So the diagnostic skill testing, which examines your ability to differentiate the gray borders between differentials, which may seem similar so much, and with a lot of distractions inside each scenario. These questions will be difficult, especially in the intense feelings inside the exam and the narrow time. So I advise you to go through the general to focused wave study. And what is that? And it's more advised to be after the bank questions. So general to focused wave study, you go through briefly a reference, medical reference, and you go through the topics which you knew that these are asked the most from your view in the questions you've solved. So you go through the topics, you grab each topic from A to Z, which are commonly asked, because you will get surprised from the ability to uncover questions and you will face in the exam. Personally, myself, I uncovered at least 5 questions from my real exam that I undertook from this way of study, such as a question of talking about the ventilation benefit in a patient with cardiogenic heart failure. So what is the mechanism? The question asks what is the mechanism of the benefit or the change in the physiology that leads to less congestion in this patient with cardiogenic failure. Another idea of how to understand or focus your way of study in the direction of the important topics is like knowing, after you solve the questions as I told you before, you went through the bank questions and you knew now what are the important topics in the UK. So like asbestosis is very commonly asked. From A to Z you have to know each detail. So there was a question which I knew that this was repeated from the previous exams, but I didn't get that fact. The question asked about the asbestos, abnormal picture in a patient with asbestos exposure of obstructive lung picture. So it is asbestos thickening, asbestos-induced thickening. Okay. Just another tip about the bank questions. The Mrcp examinees focus on the ability of the patient to be to manage the life-threatening conditions. So considering this fact, focus on these, and also the first and second line question management options, and also the drug interactions. That's it. So good luck in your exams and your prayers. Assalamu alaikum.